Hi there, my name is Natasha Caroli, and I am a Level 3 Practical Nursing student at Algonquin College. Throughout my 3 terms, I have been educated using simulation mannequins like this one right here. They're so lifelike, you almost forget that the teacher is calling all of the shots. Their simulations are very realistic and allow for the students to imagine how it might actually be in the hospital. I couldn't imagine how health education programs managed without them. In clinical situations, I feel much more confident completing these skills because I technically have done them before. I am proud to say that my education is part of the simulation education world. I once heard a saying, "Tell me and I forget, teach me and I may remember, involve me and I learn." I truly believe that this sums up simulation, and I recognized this during an experience I was part of this past May. I was part of an interprofessional team made up of BSCN, paramedics, dental hygiene, early childhood educators, and child and youth worker students. Our goal was to provide 2 programs, and I was part of the program called Helping Babies Breathe. Let me tell you just a little bit about it. Helping Babies Breathe is an evidence-based curriculum using basic interventions to increase stability and successful resuscitation rates of neonates within the first minute of life, also known as the Golden Minute. Meteor mannequin. Developed for areas with limited resources, it was made to be filled with 2 liters of water or even just air. When we think about mannequin-driven simulation, we sometimes think about the latest and greatest mannequins that allow for lifelike experience. But before we left for Tanzania, we needed a simplistic but still effective option. Our mannequin contained no fancy electronics, just water, a manual heartbeat, and lungs powered by a handheld pump. We traveled to the Bunda district of Tanzania, Africa, attending 7 healthcare centers, and we taught approximately 120 healthcare providers, including traditional birth attendants, nurses, midwives, and community workers. But how would our simulation affect our peers? Well, we needed to learn a little bit about their education first. Currently, most nurses are trained 2 to 4 years and never have the chance to experience simulation. They learn solely through books and lectures. I'll actually never forget our first day of teaching. We asked ourselves, how would we approach this teaching plan? When we brought out the mannequins, the look on those who joined us was that of curiosity. Most had never seen anything like this before, so we figured there's no better way to start this program than to allow them to hold the mannequins and inspect it. They cradled the mannequins like it was a real baby and were fascinated by its abilities to artificially breathe. Once they became comfortable, we then could start. Our equipment included the infant mannequin, a bag valve mask, and a suction. These 3 simple and very inexpensive tools could simulate a variety of events in the first minute of life. So our goal really was to provide a hands-on opportunity and how to utilize the equipment. We manually controlled the mannequin's breathing, crying, and heartbeat. If we expressed that the neonate was not breathing, the first step was to use the suction. If the neonate still was not breathing, the next was to try stimulating. If the neonate still was not breathing after that, the healthcare providers were taught how to properly use the bag valve mask, and because of the mannequin's artificial lungs, they were able to see if they were performing the skill properly. We would then simulate the neonate's cry, breathing, and heartbeat so they could feel a sense of accomplishment in their newly learned skill. As the teaching went on, we encouraged that the healthcare workers worked faster and practice. I'm sure you might all be thinking, how could we provide this education without knowing the language? Well, that was the wonderful thing about simulation. With the help of a translator, we started with group learning, where the teaching skills were translated. Then we broke into small groups, 2 to 3 learners to 1 trainer, where we were able to communicate by simulating the mannequin and demonstrating the action. Once everyone became comfortable, we could come together to debrief and clarify any outstanding questions or concerns using the translator. Many expressed how they enjoyed having hands-on practice, and they felt confident by the end of the training because they could see and feel as if the situation was occurring. But this trip couldn't have been possible if it wasn't for the months of fundraising and creating the awareness that simulation can be used anywhere. I participated in simulation conferences that invited educators from various faculties at Algonquin College to learn and experience how simulation is used in student education. Through our efforts in fundraising and our partnership with the Canadian Physicians for Aid and Relief, we were able to fundraise enough money to purchase and ship simulation mannequins that were left with CPAR for future teaching, as well as all the equipment used during the training was donated to the facilities we trained at, as sustainability was very important to us. As I returned home from this trip, I found myself reflecting on the experience and all my life as a senior nursing student. When I started at Algonquin College, I actually had no idea how simulation would affect my learning. It really has been a rewarding and positive tool to my education. But as our world continues to progress, technology continues to grow, adapting our learning follows the trend. But who says this always has to be the case? On our trip, it really proved that this doesn't always have to be. The most subtle forms of simulation can make a difference in clinical practice. Simulation doesn't always have to include the most significant technologies to make it feeling real. If you believe, the most simplest forms may prove to be just as beneficial as the most sophisticated. I've experienced firsthand the benefits of learning using simulation and teaching using simulation, and I've been able to transfer my learning through simulation to other parts of the world, thus really breaking down cultural barriers while becoming and promoting being a global citizen. Thank you.